The shoulder hurts. Where do you hurt? Where's it going? What's doing?
All right, thank you for seeing me again. After the hip, you have absolutely changed the way I feel. So now I have a weird muscle imbalance in my shoulder. It bothers me sometimes, but it really leaks up into my trap. When I'm doing my push days at the gym, I'll do 2 dumbbells and I'll do like a bench press. This side, like for whatever reason, it wants to buckle in, or like it wants to do something like where my body goes like this.
Only with a dumbbell. Does it do it when you have a push-up?
Not when I do a push-up, when I do a barbell as well. It does the same thing. So like
How low do you go?
Once I get to that point, I just stop because I know it's not good.
But in general, do you like to try to hit the bar to the chest?
Yes, I go probably just about here, like all the way down. And
so this is gonna be my first thing. There are 2 different ways of working out. There are definitely the bodybuilding. I'm trying to get muscle mass and I want to do competitions. And then there is the rehabilitative type of training, which means we never let the elbows break the plane of our bodies, which means that the barbell is never going to hit the chest, but it allows you to save the anterior capsule of your shoulder so that you don't have to visit the orthopedic surgeon. So we're gonna look at that form because it is by far the number one thing, that repetitive motion with significant amount of weight jamming into a capsule can irritate it.
Okay.
All right, go on. Where else we got pain?
Honestly, it's mainly just that, but it also occurs in shoulder presses.
Okay.
I'm trying to
Meaning you're not able to raise the arm above, or it is grinding, or is it scratchy? Is it painful? What are we looking at?
I don't know if it's painful, it's uncomfortable.
Okay.
But like I said, like my body will kind of drop that way.
Okay.
And then also when I do like face pulls, I'll get like a weird crack. Like I'll get a weird pop. Okay. Like if I go like
that, you feel the pop, and you're feeling the pop in the shoulder blade, in the shoulder. Is it numbness or tingling in the arm? Any of that?
I'd say it's in the shoulder, but it's not like a painful pop. It's like oh, that was weird.
Okay. All right. And you're right-handed?
I'm right-handed.
All right. And the left shoulder does not hurt?
Nope.
All right. So let's take a look at what we're going to do. So I just kind of like to look at what is your posture. So where the shoulder blades are they equal level? Is one side higher than the other? Tendency when we're right-handed or left-handed, whichever hand we are, this muscle mass is actually usually elevated or slightly uneven from the left. You actually are pretty level, and so is the shoulder blade level, okay? So what we want to look at is, since most of your discomfort is upper trap, I can see already that this right upper trap is definitely more elevated than the left side is. Mm-hmm. Now, during the day, how many hours are you sitting and your head forward?
A lot. Okay. A lot. Unfortunately, a lot.
Okay. So that has a tendency to do it. Do you lift before you go to work or after work?
Depends on the day. For example, today, before.
Okay. So ideally, after sleep or good posturing and then you go to lift, it's probably going to be less discomfort than after a long day of sitting with improper posture with your shoulders and head all the way forward and then trying to work your shoulders. A lot of times we create our own impingement and our own problems because of our posture. So if you're sitting at a desk and you're forward the whole time and then you keep reaching over across your midline or over to this side, you can actually create your own tendinitis or issue within the joint just purely because you're constantly leaning on one side or having that shoulder rounded and then constantly grinding the bone into the ligament or the tendon.
Okay.
So those are things to look at. So yes, it does matter what you do every day. And we have to kind of look for you the whole entire posture. So a lot of people collapse right here in the middle of their back. Okay. So if you're sitting, a tendency is either the low back is completely rounded and you're slouched over, or the mid back is. One of the two is usually going to do it. Most of us don't sit this perfectly for the majority of our day.
I never do.
And we also have a back rest. So the tendency is we have one aspect of the back actually resting against there. So it's not against you, it's just how life is. Yeah. But that's important. So what I want you to do is I want you to raise your left arm that doesn't hurt all the way up to the ceiling. Good. And then come back down and lead again with your thumb up so that it's opening the tendons and allowing for things to come. No discomfort, no problems, no pops or anything.
Nothing. Go
out to the side. So all the way out here, have your thumb up and then raise it up to the ceiling as high as you can. Good. No problems, no pops, no nothing.
Nothing.
Excellent. All right. So let's see what this one does. And I'm putting my hand over here to see if there's any pops, clicks, things that are going on. So thumbs up, and we're going all the way up. Any pain, any issues?
No.
Okay. And come back down and come out to 90 degrees. Ooh, there's a pop and a click, and bring it all the way up. Any kind of pain, any kind of issue, any kind of anything.
No, but like you mentioned, the pop on the way over.
Right. All right. So when is the last time that anyone worked on your muscles, like actual body work, like a massage or a therapist or anyone?
It's been a very long time.
Okay. So what we want to look at is, okay, let's make sure that it's not coming from the neck. So I want to clear the neck. So I'm going to keep my hands on your shoulders so that this isn't moving. And I just want you to turn your head to the right. Good. Anything increase in pain, any numbness, any tingling, anything. Okay,
Nope.
good. And then go the other way. Anything here through here feeling tight or restricted?
Tight for sure.
For sure.
Right here, I'd say it was pretty tight.
And that would definitely be where I see that it's elevated already. So once again, keep your chin just like this. Turn to the right. Good. And then turn to the left. And when you go to the left, you actually tuck your chin so as to try to get more range of motion because you're avoiding this motion and over. All right. Come back to center. Okay.
I also noticed, like, I've been doing this to, like...
External rotation for the shoulders.
Yeah.
Yep.
And that helps.
Absolutely.
A lot more.
Now, when you do that, do you keep your elbows locked to your body?
I keep them super locked.
And these are squeezing each time that you're coming back. Good. Now, just see how immediately when you did that, you tucked your chin. So your head and neck position doesn't have to be up, needs to be neutral, okay? So whenever you're lifting any upper body, it is vital that you do not tuck your chin, and everyone does. This is where we all go, is we tuck our chin and we get to this point of where we think we have more strength, and that's not necessarily the case. And that's even like on a chest press. If you let your back arch instead of keeping it flat, you're then putting undue stress right here on the neck again, causing this potential, and this is where all the nerves come out. So all of the nerves, motor and sensory to the shoulder, are right through here. So if this is in a bad position, guess what's going to be weak? And that would be your shoulder. So, you know, it's always the joint above and below that potentially affects it. So what we want to look at is the shoulder blade and whether I can move the shoulder blade at all. And if it's stuck down, because this shoulder blade should move 1 degree for every 2 degrees, the shoulder is moving. So I have my thumb underneath, which is not comfortable, I know.
Not at all.
Underneath there. So right here, you don't love that muscle.
No, not at all.
How about this side?
No, it's fine.
Okay, so you're not, this muscle is actually bound down, making the shoulder blade not move. So it doesn't want me to put my thumb under there, which I know is not
at all.
And that is for about half of the distance of your shoulder blades. So that's where we're gonna see, and that's very uncomfortable. Now, does that feel the pain you have when you're lifting?
Yeah, it's a very similar pain.
So when you're coming down and you're doing your chest press and you're allowing this to come down, see how that shoulder blade is supposed to move? You can feel it pushing into my hand. Yours isn't moving because the shoulder blade is stuck because of the muscle, and also you're laying on it, okay?
Okay.
So there are different ways of changing that. So if you can go and use a machine that's doing chest press, where you can actually be leaning against and sitting upright versus down with all of your body weight on it, the tendency is a little bit more freedom of the shoulder blade to move. But since your shoulder blade is so tight, we need to actually release the shoulder blade so that you are able to move a little bit better. Because when I bring you up, I can get about 6 degrees more than when you brought it up to here. So this is the motion we want to work on. Now, how about when you do lat pull down? Does that hurt?
Sometimes.
Yes. So hold it right here. Don't let me move you. Don't let me. Does that hurt?
No.
Okay, don't let me move you up. Does that hurt? Now, where's that head again?
It's down.
Ah, okay, good. And then come back. Okay, good. And then bring your arm here, pulling it back this way. Push into my hand. Push, push, push. Does that hurt?
No, I wouldn't say it hurts.
Now, don't let me pull you back. Keep that head up. Good. Does that hurt?
No, but I feel like I have to try, like, to move something to compensate.
Correct. So what we need to do is figure it out. So one thing,
that was weird.
Yeah. So this is your levator scapulae. So this muscle attaches on the corner of the shoulder blade, okay? And it goes up to your ear. So that is my levator scapulae. And so everything that you're doing all day, so if you lift after work and you had forward head all day and slouchy little posturing, and then this muscle has been pulled in one way. And then all of a sudden you're asking it to come back, squeeze together and have strength. pretty impossible. So hold your arm here. Don't let me push it in. Good. And don't let me push it out. Good. All right. So internal external rotation has strength. It's not a rotator cuff issue. That's not what you're doing to yourself to feel that weakness or giving away, which is a great thing. But what you are having is, I think, some neck almost burner-esque things where you're pinching the nerve through here. And so it's not giving its motor or signal to here so that your arm is feeling weak when you come back.
For sure.
Now, my strategy would definitely be only come back till about here. Okay. You already said I stop when it hurts. Well, if we never get to the point of hurt, we're going to keep more strength, because every time you have that hurt, you shut all the muscles off and then we got to re-engage them. So ideally we want to kind of start here, which I know sounds baby-esque, but it allows for you to have proper form. Do it on the ground. And start there and see if we can regain strength. And you can do, outside wide, you can do closed grip, you can do pec fly, all on the floor. So if you lay flat here, so now press to the ceiling and then come back down, you could probably still, or even use more weight now, but now you're totally supported and you're in a very small range of motion. I get it, but you still strengthen 5 degrees below and above. So it's not going to, you can still get definition. You can still have a great chest just by doing it, but it allows for your shoulder to be protected so that the head, remember, this is the humerus, okay? It's like this. It's in a capsule. So when I'm raising my arm up, it means the inferior capsule has to have range of motion. When I'm trying to move it forward, it's got to be the anterior capsule. Bring your arm back. It's got to be the anterior capsule that has range of motion, because the head of the humerus is banging into there. For you, this is not comfortable. No, not at all. And probably not as much as that. Now, once again, you're also forward rounded, so you're causing this kind of impingement throughout the day. And so now when I go in there and touch, your pecs come through here, your lat comes through here, everything comes through there, and it's pretty tender. So we want to release the shoulder blade, and we want to release all of these muscle tissues. So exactly, he does not like anything I'm doing today. So this I should be able to grab and pull and move. So foam rolling, you know what that is? Okay, so I call it the spine splitter. You want to lay on a spine splitter, a foam roller, from your pelvis or your butt all the way to your head. And you're gonna have your knees bent and your palms open to the side, palms to the ceiling. Good. So if you do this, it's actually going to stretch and extend each one of your back bend, each one of your vertebrae, but it's also going to open your pecs. So it's going to stretch this equally, and it should hopefully allow for that shoulder blade to go over that foam roller and allow it to maybe not be so attached to the skin and the tissues below, which is really what the issue is. Then we got to work on the neck. So let's have you sit back up and face that way. So the levator, okay, goes from the top of the shoulder blade to your ear. I want you to turn your neck 45 degrees to the left and then look down at your chest. So now you should start to feel a stretch right through here. Now, if you push your head into my hand at that angle coming up, you're really gonna feel that stretch. Okay, so how you do this yourself is you can hold on to the chair, or you can put this hand behind, go into that 45 and down, take this hand, place it here, and you can resist so that you get the stretch. And you can feel that stretch all the way through here. Now remember, when you do a stretch, you wanna just slowly get into the stretch, hold the stretch, and then slowly release the stretch, because the nerves are all right here. This is where everything is held. So it's really important to do that. So I think more of the tightness of the neck, the upper trap, and the levator, and the shoulder blade being a little bit bound down are the cause of your shoulder giving you weakness when you come back. So strategies, you're gonna lift your chest on the floor instead of on a bench. You can do that with a bar, you can do it with a dumbbell, you can do it with bands. You can add isometrics, make it hard. So if you wanna use dumbbells and you wanna increase the strength or the stability, put a foam roll, like a pad between the dumbbells. So now you gotta squeeze in and press the weight and do the exercise. And that will actually get you more muscles to be engaged so that we can strengthen all of the muscles that are supporting and surrounding the shoulder and make it so that you should have less pain. And it also protects more of the alignment of the shoulder itself. You also need to work on posture. You've got to get that shoulder out of being forward and rolled. And that means even when you're sleeping, it's when you're working, it's when you're doing anything, driving, we're the worst. We kind of lean on that center console. You're putting all the weight through here. So, things like side planks, those are a great exercise to do it, but only if you're in proper position. Okay. So if you're not in proper position, so lay on your side.
If I were to take a guess, it would be something like this.
Correct.
Right?
So you want to make sure that the shoulder, the elbow are perfectly aligned, that the neck is perfectly straight, and that the midsection can come up and be completely held, with this being straight, which makes it a whole nother harder exercise.
It's way harder.
Way harder, and then back down. So start on your knees. That's the progression. So start with your knees bent, only do a half of the position, come up, come down, do it very quick, not slow holds, until you get strong enough to hold it. Okay. But those are great ways for weight-bearing activities to create and decrease the sensitivity of inside of the shoulder joint, and it'll make it feel better. It is a harder exercise, 100%, but you're also asking it to do a chest press and not have that be motions. Correct.
So one more thing.
Yeah.
For example, this morning, I was doing pec flies, right?
Yep.
At like this point, if I go any further back, I get really bad shoulder pain.
So your pec fly, okay, and your pecs, you got pec minor, pec major, okay? When you're coming back here, once again, where are your elbows?
All the way
They're
back.
breaking the plane of your body. So you're causing more strain and stress on the top of your shoulder's anterior capsule. So you're causing the pecs to rip. That's the whole theory of weightlifting and creating girth, is to rip the muscle and let it grow back. That's what we're trying to do. But sometimes we do it too extreme, or sometimes we do it too much, or sometimes we do it with bad form. You can't have bad form and do it. There is nothing you're going to get, trust me, with having your pec fly back here.
Okay.
A pec fly should be hug-a-tree, unhug-a-tree, especially if you're using cables or if you're using a kinesis or wherever you are using. When you bring that together, it is this motion of togetherness that's contracting all of the pec muscles. When you come back, that's just a stretch. Okay. You're looking for the added stretch to feel like you're working more of the muscle. But really what you're doing is, unfortunately for you right now, is you're irritating the anterior capsules of your shoulder, potentially ripping muscles at the insertion point, and that's not necessarily where you want.
Okay.
And you have so much there. I mean, the pec minor and major literally go over where the lat, where the bicep is. You didn't like anything I touched over here.
Not at all.
So, we can make that face of, all of those tendons are irritated, so they're mad. So you need to protect that by not going back into this position where you are creating undue strain that's not necessary and not giving you any benefit whatsoever with your girth or strengthening. You are going to get just as much strength if you end hitting the floor with your elbow as you will if you go all the way back. I actually would say you get more.
Really?
Based off of your body and how you're lifting, absolutely, because the other way you're hurt, which means you lost all the strength.
Okay, so to just recap a little bit, foam roller between my spine.
Spine splitter right down the middle and just hold 3 to 5 minutes.
Not even, no rolling, nothing.
There's no rolling on the foam roller, just laying on the foam roller. Palms up to the air, knees are bent. It's literally to split the spine, allow the shoulder blades to I want you to feel like there's a barrel in the middle of your back. So when you roll off, it should feel like there's like this hole in the middle of your back. It should feel fantastic.
Okay. All right, and then don't let my elbows go past my body, basically.
Correct. You're gonna do a chest press on the floor.
On the floor.
Yep.
And then never let this happen.
Same thing. Yep. All chest needs to be where the elbows hit the floor. For the next 2 weeks, all chest done on the floor. No bench.
What if I'm sitting upright like this?
If you're sitting upright, same thing. Make sure that if you feel this part of the arm hit the back of it, you're done. That's the position. And then back up.
All right. And then the last thing is, I obviously have really tight traps.
Correct. You need to get that working on. So a massage is a great thing. Hypervolt, if you can handle the pressure of this. Hot showers, they work amazing.
Okay.
But that levator stretch of that 45-degree, bringing it down, giving yourself the resistance so that it's holding and creating an isometric while stretching will help to release that. That should be done throughout the day when you're working, okay? Upper traps, another great, easy, simple way to make this relax instead of going to get a massage if you can't. Bring both shoulders to your ears. Hold them there, hold them, hold them, hold them, hold them. Keep holding, keep holding, keep holding, and then slowly push them all the way down, all the way down, all the way down, all the way down, keeping that chin up. Good, and then relax. So what you're doing is you're creating a contraction on the actual muscles of the shoulders, and you're suffocating the spasm that's in there and trying to get it to relax. So you bring both shoulders up, you squeeze, you hold 1, 2, 3 with proper neck positioning, and then you lower those shoulders down, and that will relieve the tension that you're feeling right through here.
So I'm noticing when you're touching my trap, starting to like feel
fire down.
right
The
down
long
here.
thoracic nerve comes down here and goes into here. So that's because this whole part is now irritated because I have now worked on all of those motions. So ideally, yes, a massage. Massage aren't always luxury. Massage, a sports luxury, it's not a luxury, it's a sports needed thing. If you're going to work out on a regular basis, you need to give your body some love. And you need someone who knows how to work the muscle tissue to relieve it from all the lactic acid and to relieve it from all of the impurities that are hanging out in there and the tightness that's gone on because you've moved in so many different ways. So the most people, you know, when you do it, you should allow your shoulders and everything to move through the arm. And here's your back side of the arm. Okay, so that's the posterior capsule, which is never comfortable. Here's the
That's not too bad.
supraspinatus. Here's the biceps tendon, which you hate, and all the pecs. And look where that head went again.
Straight down.
So this is where you're trying to get your range of motion for the shoulder. So it really does all connect. It does matter. These shoulder blades should be squeezed always. Good. The chin needs to be level, neutral, okay? And don't arch the back because that's just how you're trying to get the motion. So when you think about where the spine is, it has everything to do. Most people don't understand that if you did just core exercises and had a bad shoulder, you'd still get 50% better.
Really?
Because half of the work is in our core. It's how we posture and how we hold our bodies to make our extremities to have a better advantage of where they're going.
Okay.
Does that make sense?
Makes a lot of sense.
Okay, so that's kind of where we're at. I don't think there's anything wrong. I don't think you've hurt anything.
Okay.
You could if you keep doing chest the way you're doing it. So chest presses on the ground or in a seated machine where it's got more control. But understand those machines are made for specific height, specific size person. And it gives you no leeway to move or angle. So things like a kinesis or a pulley system or anything that allows for you to have movement. Chest press can be palms facing in. Chest press can be palms facing down. It can be multiple ways, and it can also be angled so that you can do chest and still feel like you're getting strength, but not irritating certain tendons and certain aspects of the shoulder because you're conformed being in a specific position on a machine. So sometimes using bands and pulleys is the better way to go.
Okay. All right.
Thank you so much for coming back to another episode of my Hummingbird app. The greatest thing about shoulders is this. It doesn't always mean it's the shoulder that's hurt. So as we saw today, that it was actually the neck or the posture or the scapula. All those things are a part of the shoulder, but not always just the shoulder itself. And sometimes just modifying the exercise that we do that causes the pain will still give you strength, but not give you an injury. So please come on back and take a look at us. If you go to my Hummingbird app, you can take a look at the shoulder section. All those exercises are there, and you'll start to feel a little bit better by doing small, little, simple steps to make your shoulder feel better.